Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Plantar fasciitis. Introduction. Plantar fasciitis is an inflammation of the thick band of tissue that connects your heel bone to your toes. This thick band of tissue is called the plantar fascia. Plantar fasciitis is a common cause of heel pain. Most people who seek medical care for heel pain are diagnosed with plantar fasciitis. If left untreated, it can seriously limit your regular activities, such as walking and exercising. This program will help you understand plantar fasciitis. It explains the symptoms, causes, and treatment options. Anatomy. Healthy feet are strong and flexible. They allow us to walk and run as they support the weight of the whole body. A ligament connects two bones or holds together a joint. The plantar fascia is a ligament. The plantar fascia is the thick band of tissue that connects your heel bone to your toes across the bottom of the foot. The plantar fascia fans out as it gets closer to the toes. The arch of your foot is supported by the plantar fascia. It absorbs the pressure from the body's weight. With each step, the plantar fascia contracts and loosens. It acts like a rubber band. Also connecting to the heel bone is the Achilles tendon or heel cord. The Achilles tendon connects the calf muscles to the heel bone. The calf muscles are the muscles on the back of the lower leg. Plantar fasciitis. Plantar fasciitis happens when the plantar fascia is overused. The plantar fascia becomes inflamed and you feel pain. Normally, the plantar fascia ligament stretches to adjust to the weight of the body when a person is standing, walking, or running. When the plantar fascia is overused, it causes small tears. The body can usually repair one or a few such tears, but repeated tearing of the ligament can cause inflammation and swelling of the plantar fascia and can lead to pain. Repeated overuse and tears can sometimes cause a bone spur. A bone spur is a pointy growth of a bone. A bone spur on the heel is sometimes called a heel spur. The pain associated with plantar fasciitis is not caused by heel spurs.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Pain caused by plantar fasciitis usually develops slowly over time. The first steps that a person takes after waking up may be the most painful. The pain will likely be centralized around the heel. Most people with plantar fasciitis describe it as a stabbing pain. Pain may lessen throughout the day as the plantar fascia relaxes. The pain can return after long periods of standing or sitting. Usually only one foot is affected, but plantar fasciitis can happen in both feet at the same time. Heel pain caused by plantar fasciitis may be severe enough to affect regular activities. It can cause a person to limp or avoid walking and exercising. Risk factors. Plantar fasciitis is more likely to happen if you repeatedly strain the plantar fascia ligament. You are more likely to repeatedly strain the plantar fascia if you roll your feet inwards as you walk. This stresses the plantar fascia. Women are more likely than men to develop plantar fasciitis. The condition is most common in people between the ages of 40 and 60. The plantar fascia is more likely to become stressed if you have high arches or flat feet. This is because weight is distributed unevenly across your feet. Walking, standing, or running for long periods of time all strain the plantar fascia. Being active on hard surfaces increases your chance of developing plantar fasciitis. Any type of exercise or activity that places strain on your foot, such as ballet, may increase your risk for developing plantar fasciitis. Being overweight strains the plantar fascia because the foot has more weight to support. Shoes that don't fit well or are worn out should be replaced. The plantar fascia will not be given the correct support from shoes that don't fit well or are worn out. Tight Achilles tendons and calf muscles, which may be caused by wearing high heels, cause strain on the tissue around your heel and on the plantar fascia. Diagnosis. Your healthcare provider will review your medical history and symptoms. An exam of your foot is also needed to diagnose plantar fasciitis. During a physical exam, your healthcare provider will check which points on your foot are tender. The location of pain helps your healthcare provider determine whether or not you have plantar fasciitis. Your healthcare provider may also check the general health of your foot and ankle, such as your muscle strength and coordination. Imaging tests may be ordered to make sure your pain is not caused by something else. Usually an X-ray or MRI is suggested. Imaging tests can show if a bone spur is formed on your heel. They can also show if a stress fracture or pinched nerve is causing your pain instead of plantar fasciitis. Treatment options. Medication and therapy are the most common treatments for plantar fasciitis. Surgery is an option when medication and therapy are not working and your pain interferes with regular activities. Healthcare providers will try conservative therapies first to treat plantar fasciitis. The first recommendation is to rest your foot from the activity causing the pain. This allows the inflammation in the ligament to heal. Other conservative therapies used to treat plantar fasciitis include physical therapy, shoe inserts, and night splints. Physical therapy teaches you how to stretch and strengthen the lower leg muscles. Strong lower leg muscles stabilize your ankle and heel. Shoe inserts or orthotics may be used as arch supports that help distribute pressure more evenly over your foot. This prevents straining the plantar fascia. Shoe inserts are a key element of the conservative therapies for treating plantar fasciitis. Night splints may be recommended to wear while you sleep. They stretch your Achilles tendon and the plantar fascia. This strengthens your calf and the arch of your foot. Your healthcare provider may also recommend medications to relieve pain and fight inflammation. These medications are known as NSAIDs, non-steroidal anti-inflammatory drugs, because they do not contain steroids. Some examples of NSAIDs include ibuprofen and naproxen. Most people with plantar fasciitis improve within the first few months of treatment, but these conservative treatments may take 3 to 12 months to work depending on the patient. If NSAIDs do not relieve your pain, your healthcare provider may recommend stronger medications containing steroids. Corticosteroids fight inflammation. They can be applied to the skin, given by mouth, or taken as an injection. Corticosteroids come with side effects that your healthcare provider will explain. If conservative treatments fail, your healthcare provider may recommend extracorporeal shockwave therapy. In this treatment, sound waves are used on the skin on your foot to stimulate healing. This treatment may cause bruises, swelling, pain, and numbness or tingling. This therapy may not work for everyone. In some cases, surgery may be used to treat plantar fasciitis if all non-surgical treatments did not work. During surgery, the plantar fascia is detached from the heel bone. Prevention. The following are 10 tips to prevent the occurrence or recurrence of plantar fasciitis. 1. Do not suddenly strain the plantar fascia ligament. Increase activities such as running or walking gradually. 2. Do not stand for a long time on a hard surface without resting your feet. 3. Lose weight if you are overweight. 4. Use shoe inserts if you have flat feet. 5. Avoid wearing high heel shoes regularly. Do not wear them on a regular basis. 6. Invest in shoes that provide good support to the arch of the foot. 7. Do not wear shoes that do not fit well. 8. Strengthen the muscles of your calves and hamstrings with specific exercises for the legs. 9. Always stretch your lower leg muscles before you exercise them. 10. Do not overexercise calf and hamstring muscles. Do not suddenly increase the weight significantly in resistance training of these muscles.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Plantar fasciitis is inflammation of the thick band of tissue called the plantar fascia. The plantar fascia connects your heel bone to your toes at the bottom of the foot. When the plantar fascia is overused, it causes small tears. The body can usually repair one or a few such tears, but repeated tearing of the ligament can cause inflammation and swelling of the plantar fascia and can lead to pain. Pain caused by plantar fasciitis usually develops slowly over time. The first steps that a person takes after waking up may be the most painful. Heel pain caused by plantar fasciitis may be severe enough to affect regular activities. It can cause a person to limp or avoid walking and exercising. Healthcare providers will try conservative therapies first to treat plantar fasciitis. The first recommendation is to rest your foot from the activity causing the pain. This allows the inflammation in the ligament to heal. Medication and therapy are the most common treatments for plantar fasciitis. Surgery is an option when medication and therapy are not working and your pain interferes with regular activities.
Thank you for using Explain.